Benign tumor which we're going to discuss is hemangioma. So heme and angio, both of them refer to blood vessels and blood. So this is a benign tumor of the blood vessels. And this is because of the endothelial proliferation followed by involution or digression, you can say. And the age group is seen in below 1-year-old children. About 5 to 10% of the cases is seen among them. And the sites which are commonly affected is the lip, as you can see in this image, and then tongue, cheek, and palate. And females are more commonly affected. The ratio is almost 3:1 between females and males. So the appearance is dark reddish to purple in color. The striking feature is that it blanches on pressure, because whenever you press on the blood vessel, when the blood stops to that area, it looks whitish. So whenever you're putting pressure, it looks white. Then when you release the pressure, again it gets back its reddish or bluish color. So that's a very diagnostic clinical feature of hemangioma. And radiologically, see, all these other tumors, we didn't discuss radiological features because it does not affect the bone unless it was osteoma. But hemangioma can also be seen within the bone. It's not just on the soft tissue it is seen, because bone also has your blood vessels, the Haversian system, the whole thing is there within the bone, right? So the hemangioma can be seen within the bone as well. So when it is seen within the bone, it shows multilocular appearance, either resembling a honeycomb or a soap bubble, as you can see here. And it is ill-defined, not very well defined, and it has a cyst-like appearance. Usually they also have similar appearance, that is unilocular, multilocular radiolucency. So this also resembles that when it comes to bone hemangioma. So histopathologically, it is of two main types, which I'm going to discuss today. One is called as capillary hemangioma, and the other is called as cavernous hemangioma. So capillary hemangioma has numerous capillaries, as you can see here, okay? And all these capillaries are lined by endothelium. And there is a lot of proliferation of this small-sized blood vessels. So there are different sized arteries, if you remember from your anatomy and histology. So there is small-sized arteries, which are your capillaries. Then there is medium-sized artery. Then there are large-sized arteries, like your aorta in the heart. All those are large-sized arteries. So these are capillaries, what we are seeing here, and they're numerous, like plenty. And you will also see how the endothelium is giving rise to the newer small capillaries. And the cavernous, the name itself says, cavernous means huge spaces. Okay, so the vascular spaces in this type of hemangioma is more dilated and they're widely spaced. So as you can see, and all this red is for the hemorrhage or the red blood cells. All these are red blood cells, indicating that it's a blood vessel. And sometimes these vascular spaces become replaced by the fibrous connective tissue. Maybe this could be the example for that. So the inside of the cavernous space can be filled with the fibers. That's what they mean, basically. So cavernous are huge spaces. Capillary are like small arteries. Okay, so that's the striking difference in the histopathology. So another image for you to understand better. So you can see a lot of these small sized capillaries, correct? So there are red blood cells within these small sized capillaries. You can see a lot of them, a lot of blood vessels. You normally don't see so many of them in a connective tissue, okay? And these could be your proliferating endothelial cells as well at the periphery. And cavernous, like I said, are huge spaces and they're enlarged, and it is filled with the red blood cells. So all these are cavernous spaces, and that's why it's called as cavernous hemangioma. So quite easy to differentiate between the two. So differential diagnosis for a hemangioma is again pyogenic granuloma. Okay, but we do have a history for pyogenic granuloma, which we can correlate with what we are seeing in the histology. And apart from the blood vessels in pyogenic granuloma, especially if it's a mature pyogenic granuloma, you will also see fibrosis, and there will be a lot of inflammatory cells in case of pyogenic granuloma. That is one way of differentiating it from this. So the treatment, most of them undergo spontaneous regression. What do you understand by this is, even if you do not treat it, it regresses itself. Okay, so you don't have to treat it. If it does not undergo regression, that's when you have to do the treatment. So cavernous type may be treated by the laser therapy, or there is a combination of laser therapy and sclerotherapy, where you can inject some sclerosing agent within the tissue, and that is going to bring it down. And laser, it's the healing is good. There's not much of bleeding, so laser is these days used in many such soft tissue treatments, especially in the bleeding ones like hemangioma, because it is tumor of the blood vessels. It is quite a common sense that when you try to cut it, there's going to be a lot of bleeding. So you might want to use laser instead of using your scalpel. So that's the logic behind it. So lymphangioma is a benign tumor of the lymphatic vessels, and it is considered as a hamartoma, which is like not normal to that area, is called as hamartoma. And they're more or less a developmental malformation. Okay, and the frequent site, as you can see here, is the tongue. Tongue is the most common site, and the clinical appearance is a pebbly surface. If you see, there are like a lot of pebble-like structures on the surface, and they're like translucent vesicles. So this appearance is called as frog's belly appearance. When you look at the frog's belly, it's supposed to look something like this. So that's the clinical picture of lymphangioma. And histopathologically, you will see the dilated lymphatic vessels. Otherwise, you see lymphatic vessels which are like this size, if you see here. Okay, but these are like quite huge and quite dilated, and it can be filled with lymph. If you see here, there is like very little lymph which is seen within the lymph vessel. So that is another distinguishing feature from a blood vessel, because blood will be filled with the RBCs, okay, the red blood cells. So that's how you differentiate a lymph vessel from a blood vessel. So the treatment for a lymphangioma is also surgical excision, and recurrence is very, very common when it comes to lymphangioma, because it has an infiltrative nature. So it tends to cause recurrence, or even like come up with a new one in the neighboring draining vessel. And spontaneous regression is rare, unlike your hemangioma, which undergoes regression spontaneously. So you have to do a treatment, you have to surgically excise the tumor. So the name itself suggests that it is a neural tumor, and it involves the Schwann cells, and it also affects the perineural fibroblast. That's why the term fibroma. Okay, so it involves both nerves and fibers in this tumor, and it is the most common type of peripheral nerve tumor which you come across. It can be solitary, that is single in number normally, like you see here on the tongue intraorally, but when it is associated with what is called as neurofibromatosis, you see a lot of them and all over the body. It's not just one, like there are plenty, a lot of them in number. It affects a younger age group, and it is slow growing. It is soft, painless nodule. Okay, so the appearance of this is nodular, and even on palpation there is no pain. The patient does not feel any pain. Most common site is the skin, that is all over the body, like I said, and in oral cavity it is usually the tongue or the cheek, that is the buccal mucosa. So when I talked about neurofibromatosis, this is what I was talking to about. So you can see there are this is a nodule. So this kind of appearance is nodule. So multiple small or big nodules all over the skin, and this is his entire trunk is showing neurofibromas, and it is an autosomal dominant disorder of neurogenetic in origin, and it is because of the mutation in a gene which is called as neurofibrin. Okay, so that's why the term neurogenetic. It is a neural disorder, but there is some genetic component which is affected, that is your neurofibromin gene. So all these multiple benign fibromas are seen in a patient who is suffering from neurofibromatosis, and apart from this multiple neurofibromas, other things which we see in neurofibromatosis, it's a group of manifestations which we see. So it also affects the bone, the nervous system, which we are which is a component of the neurofibroma, soft tissue, and the skin. So there is something called as cafe au lait appearance. So cafe au lait means coffee in the milk. Okay, so because the cutaneous macules which are seen in neurofibromatosis appear as brownish discoloration, and these lesions are usually seen in white people. So when it is seen in white people, it looks like coffee in the milk appearance. So that's what it's referred to as. And the most interesting or the unique feature which is of importance to us is that it has a very high malignant transformation, that is neurofibroma. In the neurofibromatosis patient, because of the genetic deformity, it has a higher risk of malignant transformation. So we have to watch these patients with care. When it comes to the histopathology, this is the epithelium, and this is the tumor, which is composed of plenty spindle cells, because the nerve cells, if you know, are spindle in shape. Okay, so this is like entirely filled with the spindle cells. Otherwise, you normally see other structures also, right? Like you'll see fibroblasts, collagen fiber bundles, blood vessels, muscle, fat cells. So here you see it's extensively the spindle shaped cells, and they're present as interlacing bundles, and they'll have a wavy nuclei. So that's the difference between the fibroblast and the nerve. Let me just show you how it is. So the fibroblast will also be spindle shaped. Okay, even a nerve cell will be spindle in shape. Okay, but the nuclei in case of fibroblasts will be present in the center, and it will be elongated like that. Okay, so that's how your fibroblasts look, but here you will see like a wavy nuclei. Okay, so it's not essentially oval or round or elongated or any of that. So you will actually see that the nuclei is like wavy in structure. So that's how you differentiate a fibroblast from, this is the fibroblast, from a nerve cell. So that's what we see here, a lot of interlacing bundles of spindle-shaped cells with wavy nuclei. That's what gives you a diagnosis that it is a nerve tumor and not a fibrous tumor. Differential diagnosis for this is something called as traumatic fibroma. So whenever there is trauma, so we could see a similar type of tumor which mainly affects the fibroblasts, and there will be some nerve involvement as well, which is damaged during the trauma. So that could give an appearance similar. The treatment, but of course there's a history of trauma. That's how you differentiate it. The treatment is local surgical excision, and once you excise the tumor without any, you don't have to remove anything around it. It is very rare that it will come back. So that is good news in case of neurofibroma. The second benign tumor, again of nerve, is Schwannoma. Because it affects the Schwann cells, it is called as Schwannoma, and it is also called as Neurilemoma. Okay, so that's a synonym. So synonym, both of them are the same tumor. So it is a benign neural neoplasm of Schwann cell in origin, if you want to define it. And clinically, it is seen in younger and middle-aged group, and it can grow from few millimeters to several centimeters in size. Not necessarily it has to stay small. It can grow up to several centimeters. It is quite slow growing, and it is asymptomatic because it doesn't have any pain or any irritation. The patient will never know it even is there. Intraorally, as you can see in these two images, tongue is the most common site, and whenever it is seen within the bone, okay, intraosseous means within the bone. So it can be seen in the posterior mandible, and whenever it is present in the bone, it will have radiographic features. So when you look at a radiograph of the jaw, you will see either a unilocular radiolucency or a multilocular radiolucency. Okay, and pain and paresthesia is also seen, especially when the tumor is seen within the bone. What do you understand by paresthesia? Can anyone tell me, please? What is the meaning of paresthesia? What is anesthesia? What is anesthesia? When you're, has anyone undergone next? Yeah, tell me please.
Loss of sensation.
Very good. So if anesthesia is loss of sensation, what do you think is paresthesia? Can you take a guess? It's okay if it's wrong. Just take a guess.
Oversensation.
No, it's actually partial loss of sensation. Okay, so paresthesia is nothing but partial loss of a sensation or partial anesthesia, and this is a common feature whenever any tumor is pressing on the nerves or when it is involving the nerve. The paresthesia is a feature. It can also occur as a side effect for many things. Let's not go there, but here in this scenario, it is because it is involving the nerve. Histopathology is very, very unique for a schwannoma or a neurilemoma. Histologically, we see two types of bodies called as Antony A and Antony B. They're called bodies or tissue. Okay, so this Antony A type is composed of, as you can see here in this image, first look at this pink area. So this pink area is called as Verroque body. So this Verroque body is a eosinophilic area. That's why I said pink. Okay, hematoxyphilic will be blue. So this eosinophilic area is nothing but reduplicated basement membrane and the cytoplasmic processes. So what happens is in Antony type A, all the cells, the Schwann cells which are affected are arranged in a palisading manner, okay, all around this pink area, that is your Verroque body, in that manner. Let me show you. Yeah, this is another picture which is very clear. So this is the Verroque body, the eosinophilic area, And this blue thing is actually your spindle cells with the nuclei. Okay, they are your Schwann cells. So these spindle-shaped Schwann cells are arranged in a streaming fascicles around the Verroque body, that is called as Antony type A. And Antony type B, we see the spindle-shaped cells, but they're not arranged in the specific manner like Antony type A. They're haphazardly distributed in a loose myxomatous stroma. It is not at all organized, and also it is less cellular compared to the Antony type A tissue. So these two, Antony type A tissue and Antony type B tissue, are very unique and are histopathological diagnosis of Neurilemoma. And this eosinophilic area is the Verroque body. Okay, remember that much. Another nice picture to show you the Antony type A. See this very uniform arrangement even here. So there is like a pink eosinophilic area, and then there are fascicles around it. Whereas here it's Antony type B, which is just haphazard arrangement of the spindle cells in a myxomatous stroma. The treatment is surgical excision, and recurrence is not present usually, and the prognosis is excellent when it comes to a schwannoma. Quite difficult, and you have to be very careful when you're differentiating a schwannoma from a neurosarcoma.